Hi everybody, my name is Emily Langford and I'm a graduate teaching assistant in the Department of Kinesiology and Health Promotion at the University of Kentucky. In today's lab, we will learn the correct procedures to obtain basic anthropometric measurements, including circumferential measurements and skin fold thickness. These measurements are relatively simple, inexpensive, and portable techniques used to assess body composition. While more basic measurements, such as BMI, only take height and weight into consideration, circumferential or skin fold measurements can better describe how fat is distributed on the body. This information can assist health professionals when determining risk status for various diseases, including obesity or cardiovascular disease. Therefore, the purpose of this lab will be to learn the correct procedures as well as how to interpret the results of circumferential and skin fold measurements. The term body composition simply refers to what the body is composed of and encompasses fat tissue, lean tissue, mineral content or bone, and water. While it is generally accepted that lower levels of fat are associated with better health outcomes, humans do need some proportion of body fat to provide energy, insulation, cushioning, and absorption of specific vitamins, being A, D, E, and K. This vital percentage of body fat is known as essential body fat and is sex-specific. For instance, males typically require 5% of essential body fat, whereas females require at least 8%. However, greater proportions are required for optimal fitness or optimal health. Excessive amounts of body fat are associated with poor health and are a risk factor for various diseases and premature death. The distribution of body fat can also be indicative of health status. For instance, fat centralized at trunk or abdominal area is known as android fat. Individuals with android distribution may describe themselves as apple-shaped. Fat distributed around the hips is known as gynoid fat and is sometimes referred to as pear-shaped. Individuals with large proportions of android fat may be at a greater risk for a variety of conditions, including hypertension, diabetes, cardiovascular disease, and premature death. Circumferential measurements can also be useful to quantify the distribution of body fat. Common measurement sites include the neck, the waist, the mid-abdominal region, and the hips. In this lab, we will specifically learn the abdominal, waist, and hips. Participants should stand tall with their feet together. Using a simple, spring-loaded measuring tape, the practitioner should measure the circumference of the desired body region. The measuring tape should wrap securely but not compress the skin. Measurement should be recorded upon natural exhalation. Hip circumference should be measured at the maximal circumference of the hip. This is generally the maximal posterior of the buttocks. The waist measurement is taken from the narrowest portion of the torso, generally found between the umbilicus and the xiphoid process. The abdominal measurement is taken from the height of the iliac crest, usually level of the umbilicus, or the belly button. This process is the same in males as it is in females. However, you may notice sex-specific differences between your measurements. Here are the data from the circumferential measurements. Now that we have measured abdominal, waist, and hip circumferences, let's discuss how these measurements relate to health status. Waist circumference provides a measure of visceral adiposity and can be used as an indicator of obesity health risk. Risk is sex-specific and can be classified in the table provided. The waist-to-hip ratio is another simple calculation to assess fat distribution. To calculate waist-to-hip ratio, simply divide the value for waist circumference by the value for hip circumference. A higher value may indicate an android fat distribution and therefore an increased health risk. Waist-to-hip ratio classifications are also sex-specific and found in the table provided. Next, let's discuss skin fold measurements. Skin fold assessments work on the assumption that subcutaneous fat is proportional to the total amount of body fat. These measurements allow a practitioner to estimate an actual value for body fat percentage. If done correctly, body fat percentage obtained from skin fold measurements do correlate well with underwater weighing. All skin fold measurements should be taken on the right side of the body in a rotational manner. The practitioner should use a tape measure to obtain an accurate anatomical location and should make a mark to ensure consistency between measurements. Firmly grasp the subcutaneous fat using the thumb and the index finger. The caliper should be placed 1 centimeter away from the pinch, halfway between the crest and the base of the fold. The practitioner should wait 1 to 2 seconds, but no more than 4 seconds, before reading the caliper and should maintain the pinch throughout the entire measurement. Read the caliper to the closest half millimeter. Once measured, open the jaws of the caliper, remove the caliper from the pinch, and release the pinch. Rotate through sites to allow the skin time to regain normal texture, taking at least 2 measurements at each location. If the measurements are not within 1 to 2 millimeters, retest the site. Skin fold locations are also sex-specific. For females, we will measure from the triceps, the superilium, and the thigh. For males, we will measure the chest, the abdomen, and again, the thigh. First, I will mark each anatomical location with a marker. For the triceps, I'll ask our participant to flex the elbow to 90 degrees. I'll measure the distance from the acromion process of the scapula and the inferior border of the olecranon process of the elbow. For the superilium, the participant should stand tall with weight evenly distributed. I'll mark the location posterior to the mid-axillary line and superior to the iliac crest. For the thigh, I will first ask the participant to flex the hip. From here, I'll measure the distance from the inguinal crease and the proximal border of the patella and make a mark. The tricep measurement should be performed on a relaxed arm with a vertical pinch. The superiliac measurement should be taken along the natural fold of the skin with a diagonal pinch. For the thigh, the participant should stand tall and shift weight on the left leg. A vertical pinch will be used for assessment. Again, you should take each measurement in a rotational manner at least twice. If measurements are not within 1 to 2 millimeters, retest the site. Now a measurement on our male participant. When taking the chest measurement, I will first measure half the distance between the anterior axillary fold and the nipple. For the abdomen, I will mark approximately 1 centimeter inferior and 3 centimeters lateral from the umbilicus. For the thigh, I'll follow the same procedure that I did for the female. First, ask the participant to flex the hip and measure the distance between the inguinal crest and proximal border of the patella. Make a mark halfway between these locations. The chest measurement should be recorded from a diagonal pinch. The abdomen measurement is measured with a vertical pinch. The thigh measurement is also recorded with a vertical pinch. Repeat each measurement at least 2 times, rotating through locations. If the measurements are greater than 2 millimeters, take a third measurement. Here are the data from the skin fold measurements. As previously mentioned, skin fold measurements can be used to estimate body fat percentage. First, record the mode value at each of the measurement locations. Then add the three values together to obtain a sum of skin folds value. This sum of skin folds value can now be incorporated into one of the following equations to determine body density. When performing these calculations, please account for the participant's sex and use the appropriate equation. Finally, body density can be used to calculate body fat percentage using the Surrey equation. While there are no universally accepted norms for body composition, the table provided can indicate a general health status based on body fat percentage. The purpose of this lab was to become familiar with anthropometric measurements, including circumferential measurements and skin fold thickness. Please remember to submit your lab report 1 week from the assigned date, and as always, don't hesitate to reach out to your TAs with any questions.